Welcome back to 22 News in Focus. Today we're talking about how our region is recovering from COVID-19 with Dr. Robert Roos, Chief Medical Officer at Mercy Medical Center. In the early days of the crisis, there were a lot of cases coming out of nursing facilities. Then the numbers began to show that communities of color were also seeing an increase in cases. So Dr. Roos, what are some factors that could have been causing Hampden County to have the highest death rate in the state from COVID-19?
Well, as you point out, Hampden County has had one of the highest death rates related to COVID across the Commonwealth. And one of the prevailing factors that I believe has led to that is the age of the population. Western Massachusetts actually has a slightly higher age group than some of the other areas throughout the state and some areas around the country. And in particular, we know that the population, as the average age of death related to COVID is 81, that patients that live in skilled nursing facilities, long-term care facilities, et cetera, have been particularly at risk. And here in Hampden County, we suffered one of the great, really national tragedies in this crisis with the numbers of deaths that were recorded at the Holyoke Soldiers Home. And with that tragic situation alone, accounting for about 15% of the deaths in Hampden County, it certainly left a large impact on this community. In addition to age, we've also seen that areas that are more densely populated also can present additional risk, as sometimes those communities have been particularly challenged in employing the measures to be able to physically distance or social distance and prevent infection. And so in some ways, Hampden County had a few situations that led to some additional risk for the population in our area.
Right, and so you just touched on the demographic. You know, is that what we were seeing overall in Western Massachusetts, that the older community was the most impacted by this virus?
I think in several ways, yes. Certainly the older population had the highest rate of infection, as well as the highest rate of hospitalization and deaths. And so in many ways, individuals over 80 and then individuals over 70 suffered the greatest morbidity or complications and mortality or death. We do know that others have also been impacted, and there has been data that has shown that communities of color in particular have had a disproportionately negative impact from COVID, with African American and Blacks seeing higher rates of infection, higher rates of hospitalization, and higher rates of death in the state and across the country, not only here in Western Massachusetts. And as you know, as a country, we are dealing with really an epidemic of systemic racism and violence that are both public health issues that have impacted people's health for generations. And that creates additional challenges now when fighting an infectious disease like the novel coronavirus. And so, we've taken, I think, incredible steps to try to mitigate those risks, but we certainly know that they are challenges for our community to be facing head on at this time.
I want to talk about testing now. Locally, we've seen more testing sites popping up in Western Massachusetts. So is the increase in testing helping medical professionals target the people who are most at risk?
Testing is a critical thing in this disease, right? It's a tool that we have to be able to identify people who have the infection. Certainly early on in the disease pandemic, we did not have adequate testing to be able to test large groups of people. We really focused our testing efforts as a state, as a nation, on those that had the most symptoms. So now as we've been able to broaden who can get tested, it certainly gives us a better eye into the epidemiology of the disease, and it can help us identify people who may not have many symptoms at all, but could be at risk if they indeed have the virus. And so testing is a critical intervention for us to deploy, and it's one that we continue to want to look to expand.
And initially, children were thought to be low risk for the virus, but now it seems that they're presenting differently than adults. Do you know if there are many children currently being treated for the virus locally?
So you bring up an interesting point that certainly the science would show that children have had the lowest rates of infection, the lowest hospitalization rates, amongst all age groups. So there does seem to be something about kids that helps protect them against some of the most serious consequences of this virus. However, about a month ago or so, there were a number of reports coming out of New York City of an unusual presentation of kids that had tested positive for the coronavirus or likely were positive. And they were presenting with a rash, with symptoms that could be consistent with an autoimmune type response to the virus. That could even include things like weakness and fatigue, abdominal pain, and could or could not have been associated with a prior fever. And that's something that certainly here in Massachusetts we've been on the watch for. To my knowledge, there have been some cases here in the area, but they have been relatively few. And it's not something that has been as widespread, but it is always something that we should remain on the lookout for.
And so you just talked about a few things that children were presenting, as a result of the virus. Are there any other things that parents should be looking out for?
Well, parents should continue to look out for the typical symptoms that can be associated with a severe virus: high fever, respiratory distress, feel like an increase in the rate of breathing. But if your child is presenting with an unusual complaint or something that seems severe, could be abdominal pain, it could be not wanting to eat or drink, certainly I would reach out to your primary care provider. Along with this, I would also just encourage parents to not forget about the routine care that's needed. Here during this crisis, there have been reports of other types of infectious outbreaks that have occurred because kids have not gotten the usual vaccines that they should have. So even though we're being very mindful in ensuring that we don't spread the coronavirus, we don't want to forget about those other things like measles and mumps. And we're encouraging parents to ensure that they provide the regular well care for their children.
And just quickly, summer's here, so everybody wants to be outside. Children are missing their friends. They just want normal interaction. What would you say to parents to make sure that their children are staying safe during these times? Although, summer is here, so things are a little bit different now.
Yeah, summer's here. I think that's a good thing, right? We all can use a little fresh air and get outside a little bit. I would still let all folks know, whether it's kids or adults, that this is still a time to be cautious. I know we've been holding our breath for a long time, waiting to get out. And now is a time when we perhaps can take a deeper breath, but it's not yet time to breathe a sigh of relief in any regard. I still would encourage people to monitor their social circles, not to expand them too dramatically, and to take those public health precautions that have helped us reduce this virus transmission. So masks in public, keeping a physical distance from folks, and ensuring that you practice that usual hand hygiene. It will help us continue on in the future.
All right, Dr. Roos, thank you. So is there an end in sight for COVID-19? We'll have that conversation when we return. You're watching 22 News in Focus.